but it's interesting. Yeah. So let's see. Shall I? I will open the three. Let me double check the recording first. Yeah, the recording is working. So let's. Shall I open the 3 minutes?
Yeah.
Go ahead.
Hello, I'm Dr. Rohan calling from surgery. Am I speaking with Emma Taylor?
Oh yeah, doctor. Thank you for calling.
Uh, can you confirm your age?
I'm 28.
And is it okay if I call you Emma?
Oh yeah, sure.
Yeah, I can see you have some concerns about the prescription for your contraceptive pill.
Oh,
So, yeah,
yeah,
are you ready to?
yeah. It's no, to be honest, it's not like a pill. I think they didn't understand in the reception.
Mhm.
I'm looking for contraception, doctor. It's just I met that guy, and we're going fine
Mhm.
together, and we're planning to start to become sexually active. So
Mhm.
that's why I was looking for contraception.
Yeah, absolutely. I can, yeah, we can discuss about it. Uh, so, I mean, any thoughts about any particular contraception that you are looking for, or you want a
Uh,
general information?
no, to be I get some ideas, but the issue is I don't like anything to be inserted on me or anything to be under my skin or something like that. I'm not a fan of that.
Okay. Yeah. Sorry, I just missed you. You said you don't want anything inserted under
And
your skin or
uh,
inserted inside
uh,
your body. Am I right?
inserted in my body, either under the skin or my womb. So I know that there
In
is
the womb.
something like that, but I don't like any insertion.
Okay, no worries. We can talk about it. So so I mean, to be before we discuss this, obviously there are various choices, especially in the oral. So essentially, you are looking at something which is taken orally, or
By mouth, yeah,
we,
yeah, by mouth, doctor, yeah.
yeah, by mouth. Okay. Uh, yeah, we can
Probably
discuss anything particular.
there is anything else other than mouth. I mean,
There are patches. They don't go under the
okay.
skin, but they can be applied on the skin.
Oh no, doctor, I like to run on this. Usually these things will just fall down from me because I sweat a lot.
No worries at all. Yeah, right. Now, before we discuss the oral, there are a couple of options which are there. I'm going to ask some questions related to your periods and general health. Is that okay with you?
Yeah, yeah, sure.
Can you tell me, yeah, are your periods regular?
Oh yeah, it's regular, coming every 28 days.
And any heavy bleeding?
Not really.
Hmm? Uh, uh, I mean, I understand that you're sexually active. So, during periods, do you have any issues like, pain during intercourse, or any bleeding in between the two periods, or
No,
any vaginal discharges?
no, no.
Uh, have you had your first smear
Oh yeah, I had it. I think few years ago, and
few
it was
years ago?
fine. Yeah, yeah, it was fine.
That's fine. You'll be due for another one soon.
Yeah, yeah.
Uh, and any previous history of any especially sexually transmitted infections? Don't feel offended, but it's a general questionnaire we always ask about
No,
when
not
people ask for
really, doctor. No,
contraception.
no, not really. Yeah.
And
I didn't have any other boyfriend except one. Okay, but I'm not that. I'm not an easy, easy go. I really have
Mhm,
relationship. With men's.
mhm. Okay. And what sort of are you using any contraception currently, like
No, no,
condoms?
because we are not yet active, doctor. He
Oh,
did respect my wishes that I don't want to have any, maybe just intimacy, but without intercourse.
mm-hmm. Yeah, I mean, thanks for sharing and being so open. Any medical conditions? The reason why I'm asking you is, there are certain things which we can't prescribe. So, do you have any migraines?
Yeah, I do get some migraines, doctor.
Mhm.
I'm taking
Do
some
they come with
tablet.
aura?
What's
So,
or?
like, do you get flashes of light? So, migraines are
I,
two
I
types.
I
One is
do. I do get these flashes of light and spectacles in my eye. Yeah, I do know when I will get one.
okay. And are you on any medications for that?
Well, I just
I mean, I
take
can't see you are on.
no, no, no. I'm just taking some. When I go for a dark room, or I take some ibuprofen and paracetamol. They do help. I'm not fan of tablets, doctor. So I don't like medication. If it doesn't need it, if I can control it by myself, I don't need any medication for
That's
it.
no worries about it. Any lumps in your breast, or a family history of breast cancer in
No,
more than one relative, first degree
no,
relative, like mother,
no,
sister?
no, not
Mhm.
really. No.
Any problems with your liver, like, there sometimes can be a mass in like a lump in the liver, or gallstones, if
No,
you've heard
not
of
I am
that.
aware of. No, no, I don't think so because I apply for Monjaro, doctor. I'm taking Monjaro from over the over the internet. Okay, and they make a questionnaire, and I think they send me for private ultrasound to make sure my gallbladder is fine, and they decide I can fine take Monjaro. So I think I don't have any problem with my gallbladder.
You said Monjaro. May I ask how much is your weight, or how
Yeah,
do you
yeah, look,
perceive your weight?
well, I'm massive. I my BMI because they
Mhm.
did educate me about BMI when I went to them. I'm 35, doctor. So I'm a quite massive lady.
Right. And any clots in your legs or lungs, or anybody in the family has a history of clots in the legs and lungs?
No, not really.
There are just a few questions related to lifestyle, as it helps in the choice of the contraceptive. Do you smoke?
Yeah, I smoke like 10 cigarettes a day.
What about alcohol?
No, I'm not fan of alcohol, and they told me also that a lot of calories in the alcohol, so I cut it off. I'm not drinking any now.
Okay. And any use of excessive use of coffee, or any over the or any
No,
drugs,
no,
injectable drugs?
I never take drugs, no, doctor.
It's fine. And may I know what work do you do?
Well, doctor, I have my own business, I'm online business, so yeah.
Mhm. Now, I and from what you have shared with me so far, thanks for all the detailed answers. Uh, Coming to the contraceptive choice, given your weight being on the higher side and also you're smoking, our contraceptive of you know which would probably suit you is, have you? It's called progesterone only pill, which you need to take every day. Have you heard about it?
Uh, yeah,
I will send you.
yeah,
I will
yeah,
talk about.
yeah. Okay,
Yeah.
you
So
can tell me.
yes. So there are two types. One is obviously the progesterone only pill, but the other one we call it as estrogen combined pill. But given your higher body weight, and the fact that uh, you have migraines and also smoking, that is not something which would be safer for you.
Okay.
So we look at the safety when we prescribe. We use a medical criteria. We call it UKMEC.
Mm-hmm.
So yeah, it's called United Kingdom Medical Eligibility Criteria for Contraception. So there are four categories to that, and so usually when you have all the conditions which which are described, so progesterone only pill. So this pill, obviously, it comes with a risk of a weight gain. So you are like, I understand that, because one of the side effects is weight gain. So how would you look at it?
Well, I don't mind, doctor, because I'm already taking Monjaro, so that's fine.
uh, I understand that, and also this will cause your periods to become a bit irregular. You can have an unpredictable bleeding. Sometimes it will stop your bleeding as well.
hmm Well,
So,
do you have any
well, I
other
mean,
options?
I will send you the information. Obviously, you don't have to make a choice now,
Mm-hmm.
but I will send you an information about this from a website called Contraception UK, and also there are a couple of sources of information. One is called FSRH website, which will give you all the benefits and risk of of
Okay.
these pills. Now, I know you don't want something inserted inside your body. Is there any particular reason why if you're worried about it?
No, I just don't want it to feel that there's anything inside me, doctor.
Yeah, I mean, I understand. Obviously, it's your choice. However, if a hormonal coil or copper coil is inserted, you don't feel it. You only feel the
No,
threads
no,
in the
doctor.
vagina.
No, no, doctor. I don't.
That's fine. I mean, that's
So
absolutely
coming to the tablet, what is the name of doctor of the tablet? Just to read about it.
So it's called as Sirazet. it's called desogestrel, which is the drug in that. So what it does is, obviously, it acts by it makes the hostile the sperms, they ascend from vagina through the womb into your tubes where they fertilize the egg. So it creates a hostile environment for the sperms to ascend. So, and so this is how it acts usually, the progesterone, and but it has to be taken daily
So,
without a gap.
okay, that's fine. I can put it in my in my phone, and they will, that will remind me. But is this disogestrel? You said disogestrel. Is it fine with my peanut allergy, doctor?
I mean, to be honest with you, we need to find out, because this is I can see in your history. I'm not aware, to be honest, but I need to check if this the desogestrel. So sorry about that.
No
So
problem.
desogestrel is something I mean, it's a progesterone hormone, but I'm not sure whether it has any sort of a peanut. But I can check and get back to you. And I'm very honest about it. It's not on top of my mind.
Okay, that's fine. Yeah.
And I can see you have this peanut allergy, and you have this adrenaline injection. When was the last time you had it? An allergy?
Oh well, no, I'm trying to have, I think when from 2 years, and it was very bad, and I get. Thankfully, I have the injectors always with me, and it did save me.
Mhm. Mhm. Actually, yeah. So it just reminds me, there is this injection which is available, which it's called DMPA injection. So obviously, it's again a long-acting progesterone. I think that injection, the content, I think has some sort of peanut thing, but I can find out for you. I mean,
Okay,
I'm sorry, it's not on top of my mind. Is that okay?
sure, sure.
And anything particular apart from this that you were worried about? I mean, or you
You,
wanted any
you said
information?
you said I should take it in the same. So if I forgot, what should I do?
So if you forget, so depends on the type of the progesterone only pill you are taking. For example, there is the traditional POP, which is called Noriday. I will also send information about that. So it only has a 3 hour window, whereas this desogestrel has a 12-hour window. So if you forget, you can take up to 12 hours later, especially this Cirazet, without needing to use extra precautions like condoms, which so in case you exceed beyond 12 hours, you have to use condoms for 48 hours for the next 2 days
Okay,
before you can safely take.
okay, okay. So I then I will go with the disogestrel. This, yeah, I think so.
But
But
before
you
that,
make,
let me check.
yeah,
Huh?
yeah, please, yeah, please,
Okay.
yeah,
Right. Yeah. And
yeah.
also, I would like to have an appointment. We do a pill check. Obviously, we have done the questionnaire, but obviously, we need to check your blood pressure and, do your current weight, BMI. So I can arrange it with one of our nurses, if that's okay with you.
Sure, doctor.
Okay. Because the progesterone pills are safer even if you have blood pressure on the higher side. But we
Yeah.
need to
Okay,
be given your higher body weight, we need to check your blood pressure as well. Okay.
sure,
So
doctor.
that's called a pill check appointment.
Sure.
Thank you.
Thank you. Thank you. Well done. Just don't forget the, um, the missed bill rules. Okay, if something like that, you need to don't forget the missed bill rules.
Mhm.
The only thing that which was a trick in that desogestrel by name, you cannot prescribe it for patient with peanut allergy, because not all desogestrel tablets are
Mm,
free of peanuts. Okay, I will give you the trade names, which is
mm,
peanut allergy. So you never prescribe desogestrel for peanut allergy patient with the brand name. It should be the trade name. Okay, you need to find to find which type of the tablet that doesn't contain peanut and prescribe it. Okay, and that was the learning point, to be honest. Okay, so
Oh,
if
absolutely.
we
Even I was not aware. Honestly, I was
no,
not
that's
aware.
good. That's a very
What?
tricky
You tricked
one.
me.
Yes, well, you are a Boston gynae, so I should trick you. So that is,
Honestly, I've stopped reading the talks and all those ever since I've joined GP.
yeah.
But yeah,
No, because there was a MHRA warning about that. Okay,
oh, is it
so
something very recent?
well, I think it's like 1 year now. It's 1 year. So Nimri
Okay, yeah,
Cerazette.
that's recent.
So Nimri Cerazette. So Cerazette is contraindicated in peanut allergy. So Cyril, Cyril is allowed in peanut allergy. So you can see. So these are the ones that are safe in peanut allergy. Usually we are writing Cyril as the most uh, famous one, and then the other famous one is Cerazette. So Cerazette, the problem, both of them are their name is near to each other. So Cerazette is contraindicated in peanut allergy. Cyril is fine. So any patient with peanut allergy and you will prescribe for him desogestrel should be by brand name, okay, not by the scientific name. Okay, so that was the learning point. Other than that, everything for sure, there is no doubt how the history taking and all of that, it was excellent. Okay, but the other things, if the patient is more open for sure, Nexiplanon, that will be fine. Mirena coil will be fine. For sure, the copper
She's
IOG.
not
Yeah,
interested
but
in
she
anything.
didn't.
I've
Yeah,
suggested.
yeah. That's why I formulate it in a way that you don't have other choice other than
Other
the mini pill.
choices.
Yeah. So she have migraine with aura, then she cannot have the combined bill, and actually
COCP.
and also the combined bill itself, some of them also have peanut allergy. So have peanut in their component. So also it will be tricky. So that's only what I wanted to that's only the learning point, to be honest, from this case. Okay.
No,
Yeah.
absolutely. This is something because I mean, I'm very few people might be aware of this, to be honest,
Yeah. Yeah.
because
Yeah. Yeah. Yeah,
yeah,
which was a learning point for me as well. Okay, so that was a learning point for me. Yeah, and
yeah,
that's why I
absolutely.
say that.
This is very interesting.
Yeah, and that's why I say that I need to share that. I need to increase the knowledge.
Oh, thank you,
So
thank you.
no
That is
problem.
very nice. It is the best learning thing of the day today.
No problem. Let me close the recording and then we can discuss. So.